All right, guys, Dr. Charles Hogan from Memphis Spine and Sport coming at you today. Talk about plantar fasciitis, okay? What it is, why you have it, and what you need to do about it. So, true plantar fasciitis is usually you're gonna have sharp pain underneath the bottom of your foot, okay? Usually under the heel, especially first thing in the morning. So, those first couple steps getting out of bed in the morning gonna be a little rough, gonna be tight. But we actually see it a lot where people come in with plantar fasciitis. They were diagnosed with it, and they don't actually have plantar fasciitis. They have foot pain, but there's a lot of other reasons why you can get foot pain too. Some of the most common ones are actually tendonitis in your calf muscles that cause foot pain. It's kind of like tennis elbow, but in your foot. You can also actually have a bit of, sometimes you get a pinched nerve in your foot as well. But whatever it is, there's a reason why you have that foot pain or that plantar fasciitis in the first place, okay? You didn't get smacked with the plantar fasciitis fairy. Like there's something wrong with your biomechanics that's causing you to put too much pressure on your foot. And that's the number one reason why we see people who have done other treatments. They've gotten injections, they've worn the boot, they've done these things, and they're still having issues, they're still having pain or trouble moving, is because not enough issues were addressed in their kind of global biomechanics to get resolution, okay? So that's what we've got to do. The first step is knocking out the pain and inflammation. So for that, we use the laser. Super, super helpful for knocking out pain really quick, okay? So we'll get the pain and inflammation in there, and we've got to correct the alignment. So we've got to look at what's happening at the spine, the pelvis and the hips, the knee and the foot, okay? Because if your alignment is bad up there, you're always gonna be putting pressure on your foot no matter what you do. So of course, we're gonna go in there and correct the alignment and those things. I'm gonna go ahead and adjust this foot too. And then, so after we clean up the biomechanics, we've got to go in there and strengthen up all the weak areas right behind that so that these issues don't continue to come back, okay? So moral of the story is that plantar fasciitis, you've got to address the global biomechanics, and then you've got to go in there and strengthen up the weak areas. So if you have plantar fasciitis or you know somebody that does, don't get injections and wear boots and do all those things. Let us take care of you. You'll do awesome.